Hello there, my name is Elina and today I'm taking my role as a registered nurse. I work in aesthetics, so I do a variety of laser treatments, injectables, microneedling, radiofrequency, body treatments, body sculpting, and today I wanted to talk about a very common issue: acne scarring, the different types of acne scarring, and a little bit of the science of how acne scarring is formed and what is the best way to treat it. And specifically textured acne scarring, acne scarring that actually shows a dent in the skin, a pit in the skin. With acne scarring, you can have scarring that is pigmented, that have the pimple goes away and there's a red, a brown, a mark left over on the skin, a colored mark, most commonly referred to as PIH, post-inflammatory hyperpigmentation. I'm very visual and I like to draw, and I think it might help if I draw it out. I wanted to show you. So for example, you have multiple layers of your skin. So think of your skin as a layered cake, and you have the top layer, and just for my purposes, I'm just going to draw the top layer and the bottom. So the top layer, this is your epidermis, and the bottom layer, this is your dermis. So in regards to acne, when you have an acne mark and it leaves a pigment behind, then usually over time that pigment will fade. So without you having to do anything, just time itself will fade that pigment. The reason that pigment fades, this is the epidermis, that pigment just lays like this. And so as your layers continue to slough off, this pigment slowly sloughs off as well, and you'll notice the pigment getting lighter and lighter over time. If you use any chemical exfoliants, that will help lighten the pigment and help that cell turnover go faster, and so it'll get rid of that pigment faster. So I love chemical exfoliants. If you do a laser treatment, certain laser treatments will break up that pigment, and then your body will go in, your lymphatic system will go in and get rid of that. You can also do a more aggressive laser treatment like a fractional CO2 laser treatment, which pretty much causes a sloughing process. All the dead skin cells, all the bad cells get pushed up and out of your skin, and they fall off during the healing period, and that significantly helps with acne scarring. Now the other type of acne scarring is the one that's so much more difficult to treat, unfortunately, and that's a textural type of acne scar. It's a scar that actually causes the texture of your skin to be uneven. Commonly, these types of scars happen from cystic acne, the type of acne that is deeper down and more inflamed. It can also happen with acne that has been picked. So if you popped your pimple and it was a cystic pimple and you did a little too much, the way that the skin remodels causes that indentation in the skin, and that's a lot more difficult to treat, but that's what I wanted to focus on today. If this is our colored acne mark, then what a pitted acne scar looks like is more like this. So the acne scar actually has an attachment down to the dermis layer. So it's a lot deeper, it's a lot more difficult to treat because the skin has remodeled to repair that damage, to repair that inflammation. The best way to treat that type of scarring microneedling, also known as collagen induction therapy, uses a series of small little needles, very, very baby micro needles, to enter the skin down to the dermis layer, and it can go different depths, so it can go higher up in the dermis or lower down in the dermis, depending on how deep the scarring is. Some machines have microneedling that has radiofrequency, which also enhances your results because it helps with skin tightening, but also helps encourage that collagen production. The goal of microneedles is to help break up some of that scar tissue that has formed. It is a long process and requires multiple treatments. I would say a minimum number of treatments is 8 to start, and slowly within 6 to 8 months you'll start to see some results. But you can imagine it's not that deep down, so doing laser treatments or time itself lightens that pigment, but when it goes down to the lower layer of the skin and causes so much more damage, then you really need a lot of treatments. And slowly, as you do the treatments, slowly we're remodeling the surface of the skin and getting rid of this and slowly evening out some of that appearance of that uneven texture from those acne marks. As a patient, you need to have realistic expectations and understand that it's going to be a slow process that may take multiple years. But if you stay consistent, you will notice results. Your skin will remodel and look a lot better than not having done anything at all. We all look for a fast solution. We just live in a society that's very fast driven and want results now and want results right away. But with skin, you can't get results right away. Even if you start using a new product, you can't judge that product until it's been at least 6 weeks minimum that you've used it to see how is it working with your skin. The only thing that you will know right away is an allergic reaction, because your body will be like, nope, I don't want that, and cause an allergic response. And so you'll know an allergic reaction. But otherwise, if you're not having an allergic reaction to something, you're not going to know its effects until you've used it for a longer period of time. So that's something that I want you to keep in mind when you're deciding to treat uneven texture. Be patient with the results, but you will get results, and just be consistent. Communicate with your provider. I did want to add a little tidbit about fillers. Sometimes you can do fillers in the area to help lift the skin, and that's been shown to be beneficial as well. Something like Bellafill can help lift some of that, break up that connection, break up this connection, and lift the skin a bit. So it's possible, but fillers are something that have their own risks associated with them, so something to keep in mind. And it also doesn't last for a while, so you have to continue to get those results and continue to do the filler rather than fixing your skin in general. And if there's one thing that maybe you can take away from this message, is do not pick. If your pimple, a little side note, so if you push on the pimple and it doesn't easily, the pus, the white, doesn't easily come out, then do not pop it, do not force it. It will only easily on itself come out. And also incorporate some chemical exfoliants or tretinoin, my big favorite, retinol, into your skincare routine if you're having acne, and it'll help with that process. But that will be something for another video. Anyways, I hope that you enjoyed this video. Please leave a like and a comment. Let me know if I've answered all your questions. Thank you for watching, and I will see you in my next video. Bye!